Thank you, Mr. Chairman, and thank all of you for being here. This is certainly an important subject that we all need to be paying particular attention to, and I want to thank Chairman Rowe for his efforts in bringing this to light before this subcommittee. I'm a small business owner. I'm a pharmacist by trade. I own my wife now owns 3 independent retail pharmacies with about 19 to 20 employees, and we value that relationship very much with our employees. And you know, some are very long-term, been with us for 28 years, and that's certainly very important to it. And their health is important. Their health is important to me as an employer. I need them to show up for work. I depend on them. Obviously, I couldn't do what I'm doing here without them being there. So this is, you know, very, very important. However, like all small business owners, I've been faced with the dilemma of trying to reduce healthcare costs, and that's something that has really been a struggle recently, as you can imagine. I'm not any different from any other small business owner in that respect. Ms. McDonald, I want to speak to you. First of all, I think we're all familiar with Fitbit and what it does and the benefit that it can have. And, you know, as we get to a more socially conscious healthcare society, if you will, these are the type of things that we're looking at. And I'm concerned because not concerned, I'm just inquisitive as to the collection methods. As I understand it, if I were to provide my employees with the Fitbit, if I wanted to get the information, I'd have to get their permission to get it first of all?
Absolutely.
Okay.
Yeah.
I'd have to get, and that data that's relayed to me, how can we make sure that it's going to be private and it's going to be secure? They're going to want to know that. They're going to, and they should. If they don't want to know it, they should want to know it.
Absolutely. So privacy and the security of our users' data and the trust of our customers is paramount at Fitbit. So we have a very clear, easy to read, friendly privacy policy that we share with all the consumers. It's written in plain English so that they can understand that. And that's for all the consumers who use Fitbit products. When we work with an employer on an employer wellness program, they actually have to opt in and give active, explicit consent to share data with their employer. And that it's a subset of the actual data that's collected by Fitbit overall. So some of our devices collect things like heart rate or GPS when you're out running, if you're using that functionality. That data is not shared with an employer when they work with Fitbit directly. The type of data that might be shared would be steps and distance and active minutes. So data that would be beneficial and useful for them to run an effective and engaging program. The employee has the opportunity to, again, the programs are voluntary, so they do not have to agree to share their data, and they can also opt out at any time.
Okay. One final question for you. As a small business owner, we've asked about the barriers that employers have, but what about small business owners? What kind of barriers do they typically have?
I'm so glad you asked this question because I'm really passionate about supporting small businesses, and I actually think that it's through the use of technology that small and mid-sized businesses can actually have really effective wellness programs. There's a number of vendors who will only work with very large employers. We work with, and we are ourselves a small business. So that's I'm very passionate about it and really excited about it. The barriers tend to be that it's one person who's responsible for all of HR and benefits and snacks.
And that's usually the owner.
Exactly. So you've been there. So what's great about the advent of the technology that we can provide is that we make it very easy and streamlined, and we take a lot of the pain points for the small business owner, and we actually solve those for them.
Great. Very quickly, Mr. Zurn and Ms. Franklin, I know that the private exchanges, they offer a lot more flexibility. And I'm just wondering, and Ms. Franklin, I believe that Hallmark has recently changed to a private exchange, and I'm just wondering the experiences you've had with that.
It has, thank you, Congressman. It has been a very positive impact to our workforce. It's given employees the opportunity to learn how to determine what healthcare plans best meet their needs. It's not a one-size-fits-all approach, as I mentioned, and it very much empowers the individual to be part of the process. And that has been very, very valuable. It gives our employees choice. They can choose from a variety of national or even local carriers. And I think it introduces the opportunity to truly make healthcare a consumer-focused product for
Great. Thank you. And Mr. Chairman, I yield back.